Hey, welcome back to Room Review, where I do a board review question in the field of rheumatology. I'm Dr. Anna Lafian, board-certified rheumatologist. A 35-year-old woman comes to the office due to oral ulcers. I'll stop here and read the question. Which of the following is the most likely diagnosis? Behçet syndrome, herpes simplex infection, reactive arthritis, sarcoidosis, or systemic lupus erythematosus. Let's continue reading the question stem. She has multiple painful sores on her oral mucosa that began a few days ago. The patient had similar lesions 3 months ago that healed without scarring. In addition, she was recently evaluated by an ophthalmologist for blurred vision and was diagnosed with anterior uveitis. She has also had recurrent genital lesions requiring frequent gynecology appointments over the last year. On exam, there are visible oral ulcerations as well as scattered hyperpigmented skin lesions and tender indurated areas on her legs. Which of the following is the most likely diagnosis? So let's do a quick recap. A young 35-year-old female who's presenting with oral ulcers, genital ulcers, anterior uveitis, and some skin lesions that they're describing as tender and indurated, which is called erythema nodosum. So Behçet syndrome sounds like it could totally be the answer here. Herpes simplex infection can actually cause similar symptoms, but they would be defined more as vesicles, especially of the skin. So that's a maybe. Reactive arthritis could have some similar symptoms like oral ulcers and anterior uveitis, but there's no mention here of arthritis, and there's no mention here of any sort of predisposing infection like genitourinary or gastrointestinal, so we'll knock that one out. Sarcoidosis is a multi-system condition, usually would result in some sort of pulmonary manifestations, and they didn't mention anything like that, so we can knock that out. And systemic lupus, there's no mention of systemic fevers. Oral ulcers are mentioned, but there's no other mention of malar rashes, arthritis, or any other systemic lupus symptoms, so that one can be knocked out. So the answer here is Behçet syndrome. Behçet syndrome is a vasculitis, happens in young patients, usually of Turkish and Middle Eastern descent, and causes oral ulcers, genital ulcers, and pathergy and skin lesions like erythema nodosum. I had actually posted about Behçet syndrome a few days ago, so if you need more information, you can look on my page. I hope this was helpful. Please share with some medical students or medical trainees that would benefit. Take care. Bye.